today our vice president wanted to join and plan to join, and but due to the unexpected instance occurred to us, and they had to join some other official meetings, so they send you the best regards. And then maybe we are planning that our president and director of the university hospital and the other faculty members would like to send some short video messages to you later. So they gave you best regards.
Thank you. Thank you.
So your Kazakhstan Semei side, is everything ready for starting the international panel discussion for SDGs?
Yes, we are ready.
Thank you very much. So let's get started. Today's international panel discussion for SDGs. First of all, could you please let me introduce myself? I'm director for International Exchange Office of Shimane University Faculty of Medicine. So it's a great pleasure and honor to be able to share the SDGs for international panel discussion with our academic sister relationship member of Semei Medical University, Kazakhstan. And we are going to record this session, and this session is going to be delivered to our Faculty of Medicine in Shimane University, Japan. And this will be a very good and very informative lessons from your side to Japanese faculties, undergraduate school students, and the postgraduate school students in the field of healthcare providers. So in September 2015, the General Assembly of the United Nations adopted the 2030 Agenda for Sustainable Development. And then all of us pledged their commitment to 17 Sustainable Development Goals, as we know, SDGs, and 169 targets intended to ensure that all us human beings can fulfill their potential in dignity and equality and in a healthy development. The SDGs reflect a new understanding that today's health and development challenges are increasingly complex, integrated, and interlinked each other, as you know. So we are all healthcare providers. So first of all, SDG goal number 3, so healthcare promotion, exclusively address health, but health in the SDGs goes beyond SDG goal number 3, with core health issues also residing in other goals of SDGs. So all SDGs influence and are influenced by health, achieving health in the SDGs so that no one is left behind is a central tenet of the SDGs. So I'm greatly honored to be able to discuss and learn from your Semei Medical University in terms of SDGs today. Could you please introduce your present members from Kazakhstan Semei Medical University, if it's possible, or maybe later?
Yes, thank you. Yes, I can introduce yes, my colleagues, our staff. Yes, and first it's the head of our hospital, university hospital. It's Serik Aljanov. Then it's vice rector, vice chancellor on research and clinical work. It's Gulnaz Tanatarova. It's also Dean of our School of Medicine, Saltanat Uzbekova,
Mhm.
and also Dean of our small, you can say, directions. It's nursing, stomatology, it's public health, it's Dana Korahmetova. And also our colleagues from Department of Strategy and Quality, Ainur Karsakova, and so on. Who is present now at our session?
Thank you very much. And between you, Kazakhstan Semeï Medical University, and then our Shimane University have had the agreement on academic exchange. So that will be our further step for future collaboration. So could you please get started? And first of all, from our side, the Shimane University, we are now trying to act for implementing SDGs. So one of today's member, Dr. Yuhei Matsuda from our office is going to show you and introduce what we are now doing and what we are try to implement SDGs in our field of healthcare providers in Shimane. So, Dr. Matsuda, if you are ready, you may begin your presentation for
I'm ready.
our
And
implementation.
can you hear me?
Yeah, I can hear you well.
Can you see my slide?
Yes.
Okay. Yes. Let's get started. Okay. I'm Yuhei Matsuda from Department of Oral and Maxillofacial Surgery. Now I will present introduction and activities of Shimane University Faculty of Medicine. First, overview of Shimane Prefecture and Shimane University. Do you all know where Shimane Prefecture is in Japan? This picture is Izumo Taisha, Japan's most famous and the oldest mystical shrine. Population is about 700,000. Prefecture capital is Matsue City. Shimane University is divided two campuses, Matsue campus and Izumo campus. This picture is Matsue campus. The Matsue campus has non-medical faculties such as the Faculty of Law and the Faculty of Science and Engineering. Also, Matsue campus have a graduate school respectively. This picture is Izumo campus. The Izumo campus has Faculty of Medicine, which includes the School of Medicine and the School of Nursing. Of course, there is a graduate school of medical research. Shimane University has had various international exchange programs with many countries. In 2021, there were 12 exchange students from Europe, 1 from the Middle East, 10 from North America, 1 from South America, 1 from Africa, and 1 from Oceania. The region with the largest number of exchange students is Asia, where we had 86 students so far. Next, I would like to introduce what we are acting for SDGs at Shimane University. This slide shows SDGs initiatives at Shimane University. This picture shows the action of striving to make Shimane a global leader in advanced metal materials. This action corresponds to the SDGs goals of number 7, clean energy, number 9, technological innovation. This picture shows elucidation of intracellular symbiosis. These activities are related to the SDGs, safe water, number 6, and clean energy, number 7. This picture shows nurturing a global mindset through Tanzanian women education support activities. These activities are related to the SDGs, number 1, poverty reduction, number 4, quality education. This picture shows active promotion of diversity. This action is related to the SDGs, number 5, gender equality, number 8, job satisfaction. Then I will present the initiatives of our Shimane University Faculty of Medicine. So our Faculty of Medicine has 2 goals. One is the training and fostering medical professionals with professionalism and an international perspective as well as a local perspective. The other is the promotion of basic and clinical research contributing to the international and local community. So Shimane University Faculty of Medicine is contributing to so many goals of SDGs like number 3, health and welfare, number 11, town development, and number 16, peace and fairness, and so on. Our fundamental principle of Shimane University Hospital is the harmonization of community medicine and advanced medicine. Our hospital is also contributing to several goals of SDGs. So far, we have had, So far, we have held learning sessions related to the SDGs and active discussions with graduate students from various countries to promote a deeper understanding of the SDGs in our university and hospitals. So, what should we, the medical professions, act for the SDGs? Let's discuss this international important topic with you today. We have 2 topics today. Question 1, in your country, in your university, or in your hospital, how and what do you try to implement SDGs now? Question 2, if you could have a collaborative academic relationship with Shimane University, what would be potential benefit in your future SDGs? Shall we get started? Thank you.
Thank you very much for your kind introduction, Dr. Matsuda. So this is just the beginning and the introduction of Japanese side of Shimane University Faculty of Medicine. So we really would like to know what you, Semeii Medical University, are now trying to implement for SDGs, because this is a very worldwide and very important tactic and action for sustainable, keeping sustainable development in our world as a human being. So the microphone is going to be your side, and we Japanese would like to know and learn. Today, many medical students and faculty members of our university are joining this session. And can you please let us learn from your side, from Kazakhstan?
Thank you. It was yes, very benefit and interesting information about Shimane University and what activity is present for sustainable development goals in Shimane, Japan. And now, if you permit us, we would like to inform you, to give short information about what activity and measures are going in our university according to SDGs. And I would like to give the speech for our colleague. It's Nazira Asalbayeva. She works in our Department of Strategy and International Collaboration. Please.
Very nice to see you.
Hello. I'm happy to see you all at today's meeting. And now I'm going to introduce activities of Semeii Medical University on Sustainable Development Goals. Could you let me to share the screen?
Yes, please.
I can share the screen. Could you please give access to it?
Dr. Matsuda,
Yeah,
can
maybe,
you pass
maybe,
the
yeah.
end title of sharing? But
I changed the setting.
okay.
Oh, okay.
Thank you very much for sharing.
Yeah, so now I'm going to introduce activities of Semeii Medical University on Sustainable Development Goals. Firstly, let me introduce our university. The mission of our university is to train outstanding physicians, scientists, and leaders in healthcare to deliver high-quality medical care. And the vision of SMU is considered to be the pearl of Kazakhstan's healthcare through the successful synthesis of education, science, and practice. The total number of students at SMU is 5,182, and the share of foreign students is 24.6%. And students studying in English is 26%, and employed graduates share is 98%. The total number of full-time teaching staff is 427. It includes doctors of science, 24 people, PhD doctors, 36 people, and candidates of science, which includes 136 people. Semeii Medical University is engaged in activities that correspond to SDG, and one of them is goal number 3, which is ensuring healthy lives and promote well-being for all at all ages. Semeii Medical University has its own university hospital. It has 11 buildings. Total area includes 22,000 square meters. And it includes inpatient units, which is 465 beds, children's 146 beds, and adults is 319 beds. There is also a consultation and diagnostic polyclinic. It has 200 visits per shift, as well as pediatric trauma center, daycare hospital for 60 beds. And there is a table given. We can see that the number of treated patients in 2021 has increased in comparison to 2020. And
70,000.
yeah. And also it was to mention that This is the only multidisciplinary institution in the Republic of Kazakhstan, which includes child and adult hospital, as well as consultative and diagnostic polyclinic. And students of SMU have practical classes at 111 clinical bases. This is to the works of our clinical department. They organize 6 visits to 6 districts, which is Charsk, Kurchatov, and the Boroduljiva districts. And the number of patients examined is 197. And also, they conduct seminars on coronavirus infection and vaccination. In 2020, they were conducted 89 seminars on COVID-19, and they were trained 5,950 doctors. In 2021, 80 seminars were conducted, and 3,820 doctors were trained. And there is also a clinical committee. It is a collegial body that works to promptly resolve clinical issues and coordinate the activities of the university's clinical departments with practical health authorities and basic medical institutions. The clinical committee carries out its activities on a voluntary basis. Also, SMU contributed to the fight against COVID-19. Firstly, it has instructional videos. There are 16 video clips, and there is also participation of teaching staff in the investigation of COVID-19 cases, also action plan for the COVID-19 during the second wave of the pandemic. The share of undergraduate students involved in the work of students, government, clubs, etc. is 58%, and the share of students involved in volunteer activities from the total number of students on bachelor's degree programs is almost 30%. And those students visit nursery, hospitals, orphans, and as the volunteer points out, it's possible to join joint efforts to ensure that people not only live longer, but also that their lives are of higher quality, more diverse, fuller, and more satisfying. The first goal is ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. According to this goal, Semeai Medical University has developed its own internal documents to regulate the assessment and monitoring mechanisms of the education process. The academic policy about academic committee, the job descriptions of the teaching and academic staff, and the regulations on the systems of KPI and the differential payments of SME staff. Also, there is a monitoring of the learning process. It's implemented by coordinators, directors of the committee, and so on. And the frequency of it is once a month. There is also an academic integrity code. It's to impartial and transparent procedure for assessing students' knowledge at all stages and the control, current, midterm, and final examinations, and the protection of all forms of intellectual property. Semeai Medical University is one of the first universities in Kazakhstan which has started to enroll international students since 1998. And currently, the number of international students is 1,255. It's 32% of the total number of bachelor degree students. And the students are mainly from Pakistan, India, Uzbekistan, and from other countries. There is also the program called Silver University. The people who can join this study is people of age 60 and over, and who perceives education as lifestyle and a way of self-realization, and who are capable in his activity, create and use the resource base, have an idea about social education design, and ready to get acquainted with educational technologies. And the directions are as following: health and safety, digital literacy, basics of mental health, and learning. According to the goal number 5, which is achieve gender equality and empower all women and girls, the share of female staff at SMU is 72.6%. And there are 2 deputy chairmen at SMU, and one of them is Rumesta Natarova. And there are also other women in leadership positions. They are Жунисова Габасимбаевна, head of the Department of Academic Work, Margaleva Gulnara, head of the Department of Clinic, Karpova Sultana, director of the Department of Science, and Ahmedjanova Janar, director of the Department of Economics and Finance. Goal number 12 is ensure sustainable consumption and the production patterns. SMU has a furniture workshop in order to implement the university development program, and many furniture workshop was opened in 2019. The opening of the workshop allows the introduction of the lean production and economic balance, as its own furniture production, reconstruction, and repair of old furniture makes it possible to save budget funds, create new jobs, and provides comfortable living conditions in the dormitories, improving conditions for students and teachers in the academic buildings and classrooms. The main task of the workshop is to manufacture, repair, and rework cabinet furniture. According to the employees of the workshop, the opening of the furniture workshop is an urgent solution to a problem that exists in the university, which is deterioration of the furniture, doors, as well as a huge amount of furniture requiring repair works. Thank you for your attention.
Thank you very much for giving us such a nice presentation, that kind introduction of a university, and we could know that you are implementing especially the healthcare healthcare contribution as goal number 3, but your higher institute can contribute to higher education as goal number 4, and gender equality.
Your voice is not heard.
All right, can you hear me? Hello.
No, yes.
Oh, thank you very much. So I was so surprised that especially the gender equality as goal number 5, you have had so many female bosses in the field of healthcare providing systems, and that was a nice, great implementation. Yeah, we are now trying to promote more and more female leaders in the Japanese medical field. Of course, we have had some, the leaders of healthcare providing systems, but we need more female chiefs, directors for our Japanese society.
So, and it's short information, and we speak to generally our university provides our service for learning and for preparation on future physicians, doctors, for east-west part of Kazakhstan. Yes, it's a big region, and not only this region, and also in other regions of Kazakhstan. At present time, our graduates, our doctors who graduate from our university also have possibility to work, and not in Kazakhstan and outside also. And information about foreign students also you saw. And you speak about our university hospital. It's the same big hospital in East Kazakhstan, and also it's, we can say, unique that we can provide medical aid help for adults and children.
Mhm.
And also we have our branches, not only Semey, we have branches in Ust-Kamenogorsk. It's, we can say it's capital of East Kazakhstan,
Mhm.
and also in Pavlodar. If you will see the map, it's also, we have the branch in Pavlodar. So, and also we have agreement with about more than 120 hospitals, different hospitals, where there were possibility to pass practice for our students, to have practice, to have access to patient, to medical process, and to diagnose process, medical process, and other. So, and such possibilities we have in order to provide measures for to achieve sustainable development goals. And also we can say that it's also very interesting for us to have possibility to exchange, to have exchange by experience with Shimane University in different directions. And it's if such possibility is present, yes, we are ready to have cooperation with you.
Thank you very much. So from your presentation, I was so informed that your medical university, Semei, has already provided the higher medical education to like foreign students, undergraduate students, and postgraduate students from other Asian countries already, and that must contribute to higher education, like goal number 4, and that will be secondly contribute to like goal number 1, the the poverty improvement, and the hunger, like the very primitive goals, like goal number 1, goal number 2, and then or higher goals, like goals for society, such as the working and the economic growth, like goal number 8, goal number 9, industry, goal number 10, 11. So your university, Semei Medical Uni, and the hospitals could provide and contribute to other various goals related to healthcare providing professions. Is that correct, right?
Yes, it's correct. It's correct. You speak yes about all these goals. Indirectly, also we have effect also to all these goals. It's correct.
Yeah, various goals are interlinked each other, and we are completely agree with your opinions that our medical and healthcare providers could contribute to various goals because they are so integrated. So
yes.
Yeah, thank you very much. So are there any presenters today from your side, or
no,
okay,
just short information.
thank you very much. And then let me share some slides for our discussion today. This is the, can you see my slide? Yeah, this is an very interesting schematic drawing from the Stockholm, the university, right? So SDGs from 17 goals can be classified into 3 levels. So one is economy. So we cannot change soon, but I think our healthcare providers should belong to the level of society. So like your presentation, as I told you that our medical and dental healthcare providers could contribute to the society level. So environmental level, like environment on the continent, we cannot contribute to these level easily, but we can contribute to this level, society level, because we are all healthcare providers and educators. Then secondly or third, the economy level can be fostered. And then finally, the goal number 17, between your university and our university can be collaborating each other, and that can contribute to goal number 17. Then I just checked your level from Kazakhstan, from the University of Cambridge, and Kazakhstan has already contributed to many various goals of SDGs. So as you just said, like goal number 3, your implementation will be wonderful, right? And I just understood that from your presentations and talking, and this is really realistic and correct. Yeah, so on the other hand, this is the Japanese contribution of SDGs. So your side and our Japanese implementations are now, of course, going on. So I was really happy to know that your Kazakhstan's the implementation will be glowing and wonderful. I just stopped.
Yes, some areas are present to improve. Yes, to improve, maybe to improve of creation information about work is going in Kazakhstan, and also directly to improve the measures for achievement of the goals.
Are there any questions or comments from our Japanese side or your side? Now our university students, undergraduate students are also attending.
I'm asking also for, I'm asking my colleagues, maybe somebody want to add something.
誰か日本の先生でもare there any questions or comments from Japanese students, or today the undergraduate school student is also attending, or Dr. Okui or other faculty? Okay, yeah. Is everything clear, or?
Also no additional information from us. I asked my colleagues.
So if we could have a further collaboration in the field of medicine or healthcare between your Semeii Medical University and our Shimane University Faculty of Medicine, what could be more and more improved or fostered for future SDGs? What do you think?
First steps. I think the main, if I understood, also you have own hospital. Yes, it's a big hospital and very developed. And I think it could be interesting for us in exchange of our knowledge about medical care, healthcare, yes, providing in different directions. Yes, clinical directions. I think one. Second one, it's also our region. Our region is the region which was in past time was affected by function of Semei nuclear test site. If you know, and also we have also Institute for Radiation and Ecology Research, and also we have many data, and also data of people who was affected by radiation in past. And also in this direction, I think we can have collaboration, and also research in public health, yes, joint researches. And I think it will be interesting to have collaboration in any direction. Yes, and maybe, and also we are interested, for example, in cardiovascular surgery, in oncology, neurosurgery, traumatology, and nuclear medicine, such directions. It also maybe it's the modern and we can say it's research priorities, different research priorities in different directions. Also, we could work together, like the cellular therapy, and other. So, and maybe you can relate us, and also you can give us maybe some information about research where we could have activity where we could collaborate with you.
Thank you very much. Yeah, that will be a wonderful opportunity for us as well. And yeah, through today's SDGs panel discussion, we could know and deepen our understandings of each universities. And we are really happy to know about what you are doing for SDGs. And then I got to know that your implementation for SDGs have already well conducted and started, and that would be very, very nice talk with you, discussion. And our staff members and undergraduate school students would like to learn and know from the video recorded today, and that will be a wonderful opportunity for both of us in your future collaboration in the field of academia. Yeah. Thank you very much.
Thank you.
Yeah. So yeah, now the already scheduled time has passed, and thank you very much once again, and let's have a mutual collaboration.
Okay. Thank you very much. And we have your links. You have our links, and I think it will be possibility to continue with our association.
Yeah.
And we will be very glad to continue to work with you.
Yeah. Thank you very much. And let's
Thank you.
close today's session. Thank you very much.
Goodbye.
Have a good day. Thank you very much.